The causes of non-communicable diseases are complex, usually a combination of genetic, physiological, socioeconomic, environmental and behavioral factors. Many factors lie outside of the health system, and directly relate to the conditions in which we are born, live, work and age. Preventing, managing and controlling non-communicable diseases requires a comprehensive vision for implementation of effective strategies.
The health systems of the EU member states, both at national and local level, will be able to respond to current and upcoming challenges and opportunities for NCD prevention, control and treatment, including demographic change, increasing digitalization, environment and climate change, and evolution of health determinants. This is more than a dream. This is a vision. Prepared by the Joint Action CHRODIS Plus partners and by the Steering Group on Health Promotion, Disease Prevention and Management of NCD's members. Based on the results of Joint Action CHRODIS Plus and past CHRODIS. Endorsed by the 28 EU member states represented in the Governing Board of Joint Action CHRODIS Plus. Whereby EU member states will ensure and sustain availability of high-quality and accessible healthcare, including increased investment in preventive measures for NCDs. They will engage in working across policy areas, involving non-health stakeholders and linking health policy with people's living environments, including school, work, and leisure activities. They will sustain and encourage local innovative practices, which respond to local needs, improve the safety, quality and acceptability of care, and offer the opportunity to generate new approaches to leverage health in all sectors.
EU member states recognize the importance of the exchange of good practices between EU countries for NCD's prevention and management to reach the endorsed vision, specifically in the key fields of actions that were agreed by EU member states in the EU Employment, Social Policy, Health, and Consumer Affairs Council, and prioritized by the SGPP and GB members. Specifically, they acknowledge health promotion and prevention of chronic diseases, NCDs, and the closely related area of health in all policies, as the two main categories of future engagement and investment.
In these fields, and in the related areas, CHRODIS Plus work package leaders recommend the adoption of a long-term NCD strategy and action plan based on horizontal and vertical collaboration. While lessons from the CHRODIS Plus policy dialogues highlight the importance of a health in all policies process, involving subnational authorities and social partners, as well as transferring and integrating initiatives across EU states or regions.
The integration of good practices into national policies, their sustainability in the medium to long term, and the EU added value of this learning and implementation process are the three keystones identified by CHRODIS Plus to support the implementation process and exchange of experiences and lessons learned. To assure a successful integration of results of an initiative such as CHRODIS or CHRODIS Plus into national policies, it's important to manage a variety of dimensions. To guarantee the sustainability of those results, it's fundamental to implement specific mechanisms.
The actions which can guarantee to the EU member states the greatest EU added value of the good practices exchange are: to facilitate the digital transition and the sharing of national data sources, linking national/regional NCD strategies and plans to existing targets for health and sustainable development, benchmarking and clustering among EU MSs with similar needs, networking across the EU to spread knowledge and experiences, using EU funds and economic incentives to promote faster implementation of shared objectives, and encouraging long-term integration and sustainability of good practices.
Over the course of CHRODIS Plus, SGPP members, the CHRODIS Plus Governing Board and CHRODIS Plus partners reached key conclusions about the successful integration and sustainability of good practices in national policies in order to reduce the burden of NCDs. These included: involvement of key stakeholders, establishment of functional communication amongst stakeholders, building up political support and including new practices in existing political strategies. Facilitating alignment with existing national policies, providing a clear framework and tools to support transfer, adoption, and evaluation of the outcomes. Ensuring adequate economic, technical and human resources support while building from what works currently and acknowledging the valuable experience and potential of existing staff.
Finally, SGPP and GB members identified 18 proposals focus on sustaining CHRODIS Plus results beyond 2020, aimed at further developing the knowledge and EU cooperation on chronic diseases and conditions, and will enrich the EU's capacity to face the NCD challenges and understand the drivers and mechanisms leading to sustainable health systems. Through this list of future commitments, this document aims to open dialogue between EU member states in order to propose and support these initiatives, committing themselves in the first instance.
What has been just presented is an abstract of the deliverable 4.2 of CHRODIS Plus, which is the CHRODIS Plus consensus statement on the EU added value of cross-country collaboration in the field of health promotion and prevention and management of chronic diseases beyond the project. A summary version has been prepared and will be published in all the EU official languages. The preparation of this report was guided by the Ministry of Health of Italy, the Italian National Agency for Regional Health Services and the Andalusian Regional Ministry of Health and Families. Our sincere gratitude goes to all of those partners, governing board members and member of the EU SGPP who participated to the co-writing of this document carried out through several workshops, webinars and online surveys.